Hello students, welcome to INI-CET May 2024 anatomy question discussions. Now, first question, which of the following joint is not formed by the structure shown in the picture? I told you, definitely one question will be there in the INI-CET about the joint and their example. So last November INI-CET, you got the question from the joint between the malleus and incus. Now this time, they gave the vertebra, they gave thoracic vertebra. Why I am saying thoracic vertebra? The spine. The spine is very large and more posterior, and they also given the costal demifacet in the thoracic vertebra. So this is thoracic vertebra. Now, what type of joint it is not seen in the vertebra? Okay, right. Now, between the two vertebra, we have the intervertebral joints, that is a symphysis joint. All the midline joints in the body are symphysis type. Pubic symphysis, intervertebral joints, the joint between the vertebral bodies, symphysis type. The joint between the xiphisternum, the joint between manubriosternal joint. So all the midline joints are symphysis joint. So now symphysis is present. Okay, right. Next, I told you thoracic vertebra. Thoracic vertebra have costal demifacet. Costal facet. This costal facet articulate with rib. What type of joint between the costal demifacet and the rib? They are plane type of synovial. So costovertebral joint, or plane type of synovial. So plane type of synovial also present. And the joint between the facet, the joint between the vertebral arch, the two articulating facet are plane type of synovial. The facet joint or zygohypophyseal joint or the plane type of synovial. The joint between the articulating facet or plane type of synovial. Okay. And between the vertebra, you also have ligaments. The ligaments connecting the vertebral arches. What are those? Ligamentum flavum, supraspinous ligament, interspinous ligament, longitudinal ligament. So ligaments connecting the vertebral arches, again this is called syndesmosis type, a type of fibrous joint. Okay, so joint between the vertebral arches, intervertebral syndesmosis. The bones are held together only by ligaments. So syndesmosis joint also present. So in the thoracic vertebra, you have syndesmosis type, fibrous joint, symphysis type, yes, plane type of synovial, yes, but synchondrosis, it is not seen in the vertebra. Okay, synchondrosis is not seen. Right, synchondrosis, otherwise known as primary cartilage joint. It is not seen in the vertebra, thoracic vertebra. Right. Next, from neuroanatomy, we got 3 questions. Again, this question is a repeat question only. 2020-21 exam, they gave this question. Again, they repeated this question with new pattern. They have given 2 images. Usually, they will give 1 image and ask the question. Now, for a change, they are given 2 images and they ask the question. The marked part in the first image has a direct connection with which of the following part marked in the second image. So, in the first image, this is cerebellum. I hope you can identify the cerebellum clearly. Okay. And cerebellum is connected to this structure, and this is our midbrain. So cerebellum connected to the brainstem by cerebellar peduncle. Cerebellum connected to midbrain by superior cerebellar peduncle. So they are asking about superior cerebellar peduncle connection. Superior cerebellar peduncle, till now they gave question 2 times. Till now they gave this question 2 times. 2020 AIIMS exam, they gave this question. Decussation of superior cerebellar peduncle taking place at midbrain pons medulla. What is the answer? This is superior cerebellar peduncle. This is middle cerebellar peduncle. And this is inferior cerebellar peduncle. So superior cerebellar peduncle is decussating at the level of midbrain. That is a question we got. 2020 AIIMS exam. The exact answer is decussating in midbrain at the level of inferior colliculus. Superior cerebellar peduncle decussate at the midbrain exactly at the level of inferior colliculus. 2021, the superior cerebellar peduncle after decussation, which is ending at, they go to superior colliculus and they also go to thalamus. In the superior colliculus, they go to red nucleus. So superior cerebellar peduncle end in red nucleus and thalamus. The same question was asked in a different way. Instead of asking theory question, they give two images and they ask this question. Now see the diagram. Now the first image I told you, this is our superior cerebellar peduncle. End in. We know the answer. What is red nucleus? Next one is thalamus. Now see the diagram. Now second image, they given the midbrain. In the midbrain cut section, we are seeing this part. What is that? If we take the cut section of midbrain, the small posterior part is called a tectum and the large anterior part is called cerebral peduncle. I hope you know that. Now cerebral peduncle is having three parts. This is A, this is A, this is B and this is C. What is A, B, C? A is called tegmentum, B is substantia nigra, C is crux cerebri. C is crux cerebri. Okay. Now, in the tegmentum of midbrain, you see one highly vascular structure, that is our red nucleus. Red nucleus is seen in midbrain at the level of superior colliculus. Don't forget this. This itself a worth question to ask. So, red nucleus present in midbrain at the level of superior colliculus. So, number 2, in the tegmentum of midbrain at the level of superior colliculus. This is superior colliculus. Okay, that is our superior colliculus. And this is aqueduct of Sylvius, cavity in the midbrain. So, in the superior colliculus, you see the highly vascular nucleus, that is our red nucleus. So, B substantia nigra, C crux cerebri. Okay. So, what is the answer? Superior cerebellar peduncle after decussation end in red nucleus. What is red nucleus? 2 is red nucleus. So, answer for this question is 2, red nucleus. Okay. Right. Repeat question only, but they asked a different way. That's all. Now, which of the following is not seen in the floor of inferior horn of the lateral ventricle? Again, they are asking a very basic question only. It is not a very tough. See, in the section of brain, I told you, in the coronal section or cut section, you have to remember certain basic points. Now, third ventricle, it is the midline cavity. I hope you know that. Now, what is lateral to third ventricle? Lateral to third ventricle will be your thalamus and hypothalamus. Thalamus and hypothalamus will be lateral to third ventricle. So, this basic relation you should not forget. Likewise, for the lateral ventricle, you have to remember the another basic rule. I told you in the module also, lateral ventricle and the caudate nucleus, they are interrelated. Now, what is lateral ventricle? Lateral ventricle, you know, it is a cavity in the cerebrum. Cavity in the cerebrum, telencephalon. Now, lateral ventricle is having 4 parts. Now, this is the anterior horn and this is the body. This is posterior horn and this is the inferior horn. So, lateral ventricle and the caudate nucleus, they are interrelated. Lateral ventricle and the caudate nucleus, they are interrelated. See here. Now, anterior horn, in the floor, you are seeing head of the caudate nucleus. Yes or no? Yes. What is anterior horn? Anterior horn is extension of lateral ventricle into the frontal lobe. Now, see the body of the lateral ventricle. Body of the lateral ventricle, in the floor of body of the lateral ventricle, again, you are seeing the caudate nucleus. In the floor of the body or central part of lateral ventricle, yes, we have the caudate nucleus. Now, same caudate nucleus, this is the tail of the caudate nucleus. The tail of the caudate nucleus, it is not in the floor of the inferior horn. In the inferior horn, the roof is formed by the tail of the caudate nucleus. This basic relation you forget. Okay, this is what they asked you. So, in the floor of lateral ventricle, in the floor of inferior horn of the lateral ventricle, tail is not seen. If you remember this one point, easily you answer this question. See the diagram. is a section showing the inferior horn of the lateral ventricle. Okay, right. Now this is inferior horn. Now I told you just now the tail of the caudate nucleus form roof. What about the floor? In the floor, we have hippocampus, fimbriae, and the collateral sulcus, the very deep sulcus, they give one eminence that is called collateral eminence. So these three structures, they form the floor. Okay. So which of the following is not seen in the floor? Fimbriae is present, collateral eminence, hippocampus is present, but not our tail of caudate nucleus. So the tail of caudate nucleus, it is in the roof, not in the floor. So remember some basic relations, that itself sufficient to answer these type of questions. Okay, right. Next, again this is a repeat question only. If my memory is correct, they gave this question in 2018 AIMS exam. 2018 November AIMS exam, they gave this question. The spinal nucleus of trigeminal has second order neuron to carry which type of sensation? In 2018 November AIMS exam, the question was about the mesencephalic nucleus of trigeminal carries proprioception. That is a question we got in 2018 November, and 2024 May AIMS exam, the question is about the spinal nucleus of trigeminal. Okay, right. So the trigeminal nerve is having three nucleus. What are those? Mesencephalic nucleus of trigeminal, chief sensory nucleus of trigeminal, and spinal nucleus of trigeminal. Now, mesencephalic nucleus of trigeminal, it is present in midbrain. Chief sensory nucleus of trigeminal present in pons. Spinal nucleus of trigeminal present in medulla, and it is also extending into C1, C2 segment of spinal cord. Okay. Now, what are the sensory modalities carried by these nucleus? Spinal nucleus of trigeminal carries pain and temperature. Pain and temperature, the very basic sensation, pain and temperature is carried by your spinal nucleus of trigeminal. Now, what about chief sensory nucleus of trigeminal? They carry pressure, touch, and vibration. So, pressure, touch, vibration carried by chief sensory nucleus or principal nucleus of trigeminal. So, mesencephalic nucleus of trigeminal, it is present in midbrain, you know already, and they carry proprioception. Okay, all right. So, we know the answer. Spinal nucleus of trigeminal carries pain and temperature. Right. So, we got three questions from the neuroanatomy. All the three questions are repeat. Now, next is this question. Again, it's a repeat question only. The structures pass between the marked area A and B. So, in the diagram, they are given constrictors of pharynx. What are structures pass between the constrictors of pharynx? Again, not a new question, repeat question only. On the diagram, yes, we are seeing three constrictors A, B, and C. A is a superior constrictor, middle constrictor, and inferior constrictor. Now, you have a gap between the superior constrictor and the base of skull. That gap is called sinus of Morgagni. The gap is called sinus of Morgagni. Sinus of Morgagni transmit auditory tube, levator palatini muscle, and two arteries, ascending palatine artery and palatine branch of ascending pharyngeal artery. Okay, and plus or minus tensor palatini muscle. Tensor palatini muscle not given in anatomy books, but still in ENT books they are mentioning. So please add tensor palatini muscle as a plus or minus option for structures passing through sinus of Morgagni. Okay, right. Next, structures passing between A and B, between superior constrictor and the middle constrictor. Now here we have one ligament. What ligament? Stylohyoid ligament, number 1. Number 2, glossopharyngeal nerve. Number 3, stylopharyngeus muscle. So these three structures pass between A and B. Superior constrictor, middle constrictor. Now between middle constrictor and inferior constrictor, you have one nerve, internal laryngeal nerve and superior laryngeal vessels. Now below the inferior constrictor, recurrent laryngeal nerve and inferior laryngeal vessels. Okay. So now the structures passing between superior middle constrictor. What is it? Glossopharyngeal nerve, stylopharyngeus muscle. These are structures present between A and B. And one more ligament is present. They are not given. So please remember, stylohyoid ligament also pass between A and B. So answer for this question is D. Okay. So now the nerve marked in the picture has its root value from. So they give diagram, lung image. I am saying this is the left lung and this is the anterior border and this is posterior border. I have marked A is anterior border and posterior border. Why? Anterior border, it is thin and sharp. Posterior border is blunt. So if that is the anterior border, now in the diagram, we are seeing hilum. Yes. Now in the hilum, the structures arranged from anterior to posterior. Structures in the hilum from anterior to posterior. The anteriormost structure in the hilum of lung is pulmonary vein, followed by pulmonary artery, followed by bronchus, and finally bronchial artery. And this question was given in 2021 INI-CET exam. Arrange the structures sequentially from anterior to posterior in the hilum of lung. This arrangement, it is same in right lung and left lung, same both. Okay. Now from above downwards, in the hilum of the left lung, this is hilum of the left lung. Now from above downwards, this is the pulmonary artery. Now can you see the thick white line here? That is a bronchus and this is a lower pulmonary vein. So in the hilum of left lung, from above downwards I am saying pulmonary artery, bronchus and the lower pulmonary vein, the arrangement. Okay. Now in front of the hilum of right lung and left lung, we have one nerve. Behind the hilum of right lung and left lung, we have one nerve. Now in front of hilum of right lung, anterior to the hilum of lung, which nerve? Phrenic nerve, phrenic nerve, phrenic nerve. Posterior to the hilum of lung, which nerve? Vagus nerve. Now these questions were given repeatedly in 2015, 16, 17 NEET exam. 2015, 16, 17 exam, NEET exam conducted for 10 days. Each day 2 paper and they'll give percentile for overall marks. Okay. But 2018, yes, the government decided to conduct single exam, NEET PG entrance exam, all over India, single paper with equal weightage of marks. So in old NEET exam, 2015, 16, 17 range, they gave this question repeatedly. Structures anterior to the hilum of lung, phrenic nerve. Structures posterior to the hilum of lung, vagus nerve. Okay. And in the AIMS and INI-CET exams, the questions were coming repeatedly about the phrenic nerve. From 2016 AIMS exam, I am saying, we are getting questions repeatedly about the phrenic nerve. Okay. So now, phrenic nerve relation, you have to know some basic points you have to know. So phrenic nerve, it is the mixed nerve. I hope you know that. Carries sensory fiber and motor fiber. Motor fiber to diaphragm. Sensory fiber to pleura, pericardium and diaphragm. Okay. Now what is the root value? C3, C4, C5. Majority of the fibers are coming from C4 only. Now phrenic nerve relation anterior to scalenus anterior muscle. So scalenus anterior muscle is the muscle divide the subclavian artery into 3 parts. I hope you know that. Now see the diagram. Now in the diagram, we are seeing this artery here. That is the subclavian artery. Now in front of subclavian artery, you are seeing this muscle. That is scalenus anterior muscle. So phrenic nerve in the neck anterior to scalenus anterior muscle. Fine. Now in the thorax, the phrenic nerve is passing anterior to the hilum of lung. Anterior to hilum of lung. I hope you know this. This relation only they are asking. Now, try to identify these structures. They gave this question 2020 November INI-CET exam. They gave this question. Chances are there to ask in the coming NEET exam. Okay, they are giving cadaveric image only. So try to identify these nerves in the diagram. Now what is A? What is A? A is the nerve which is going and supplying this muscle here. What is this muscle? Your trapezius muscle. Very good. So what is the nerve supply of trapezius? Trapezius and sternocleidomastoid muscle supplied by spinal part of accessory nerve. So spinal part of accessory nerve supplies sternocleidomastoid muscle and trapezius muscle. Very good. Now what about B? Sir, B we are seeing like thread-like structure, and in between the threads you are seeing some swelling. That is a ganglion. So B is very good. Cervical sympathetic chain. Okay. What about D? D is vagus nerve and C is our phrenic nerve. Okay. So vagus nerve present between the artery and the vein, common carotid internal jugular vein. Okay. And C is the phrenic nerve. That is the scalenus anterior muscle. So C is passing anterior to scalenus anterior muscle. Okay. So C is the phrenic nerve. So this image is very important. You may get this image for the coming, yes, NEET exam. Fine. Right. So in the diagram, they given the lung hilum, left lung hilum in front, anterior. Now phrenic nerve, what is the root value? C3, C4, C5. Sorry, you told C3, C4, C5. It is given only C4. The bulk of the phrenic nerve is coming from C4 fiber only. That is why when the phrenic nerve is irritated, the patient have pain over the tip of the shoulder. Why? Tip of the shoulder dermatome. Tip of the shoulder dermatome is C4. The bulk of the phrenic nerve is coming from C4. That is why when the phrenic nerve is irritated, the patient have pain over the tip of the shoulder. Okay, right. That is the answer for this question. Option A. Clear? So phrenic nerve root value C3, C4, C5, C4. Okay, right. Next. Again this question, repeat question only. The professor underwent left parotidectomy. Post surgery, she complains of left lower lip paralysis. Which structure is involved? Okay, so he's having the involvement of lower lip. So for this, right. Now what are the 5 terminal branches of facial nerve? I hope you know that. Temporal branch, zygomatic, buccal branch, marginal mandibular and cervical. 5 branches. Now what are the muscles supplied by these 5 branches? It is very difficult to remember. Try to remember certain basic muscles. Exam point of view, you get question only about these muscles only. Okay. Now in the case cervical branch of facial nerve, it supplies platysma. Very simple. Then marginal mandibular supplies lower lip muscle. Lower lip muscles. What are those? Depressae labii inferioris, depressae anguli oris and mentalis. Buccal branch, remember zygomaticus muscle and buccinator muscle. Zygomatic branch supplies orbicularis oculi. The temporal branch supplies frontalis and the corrugator superciliary muscles. These are the important muscles you have to remember for the nerve supply. Okay, right. So now, patient is having lower lip palsy. What is the answer? Marginal branch of the facial nerve. Marginal mandibular branch of the facial nerve. See the question. So patient is having lower lip palsy. So what is the answer? Facial nerve, marginal mandibular branch. But marginal mandibular branch is not given in the options. Facial nerve, main trunk, facial nerve, cervical branch, temporal branch. So marginal mandibular branch is not given. Then what to choose? What about cervical branch? Cervical branch supplies platysma muscle. Now what is the action of platysma? Platysma muscle, it depresses the mandible, number 1. Number 2, it also draws down the lower lip and the angle of mouth. So even in the case of cervical branch of facial nerve involvement, the patient is having lower lip palsy because this muscle also pull the lower lip and the angle of mouth down. Clear? So whenever you see the case of lower lip paralysis, what is the best answer? Marginal mandibular is the best answer. Marginal mandibular branch of facial nerve is the best answer, greater than cervical branch. Marginal mandibular is not given, then you can go for cervical branch of facial nerve. Okay, right. So what is the answer for this question? Patient underwent parotidectomy and lower lip palsy. Which structure is involved? Marginal mandibular. That is not given, then go for cervical branch. Okay, right. So B is the answer for this question. Facial nerve main trunk means complete palsy of the facial muscles. All the muscles of the face involved. Okay. Temporal branch, again frontalis, corrugator superciliary involved. Okay, right. So answer for this question is B. B is the answer for this question. Next. So they gave the heart and they are asking the blood supply. I told you in the module itself. Usually the questions in the heart is only about the blood supply, arterial supply and the venous drainage. But all they want to ask any question from the heart, first preference they go for blood supply only. Otherwise, they go to interior of right atrium or the interior of right ventricle. Then they come to the borders and surface. So first preference is we have the blood supply of the heart. Now see the diagram. Now in the diagram, we are seeing the section. Now in the section, now these two are the atrium. This is the right atrium, right ventricle, left atrium and the left ventricle. Now between the two ventricle, yes, you are seeing this structure marked as A. What is that? That is the interventricular septum. So they are asking the blood supply of interventricular septum. See the diagram. Yes. So what is the blood supply of interventricular septum? Interventricular septum. Interventricular septum is having two parts. Now in the diagram, muscular part is marked. So muscular part, it is coming from the muscular proliferation from the base of the heart. And interventricular septum also have the membranous part. Now the membranous part is coming from two sources. Number one, bulbar septum, and number two, AV cushion or endocardial cushion. So membranous part is coming from two sources, bulbar septum and AV cushion. This is old INI-CET question. Okay, the membranous part of interventricular septum is coming from AV cushion. That is a question they gave in the old INI-CET exam. Okay, now what about the blood supply? Now the interventricular septum, it is supplied by anterior 2/3 of the interventricular septum. It is supplied by anterior interventricular artery. Anterior interventricular artery. Now posterior 1/3 of interventricular septum is coming from posterior interventricular artery. Okay, the septal branch of posterior interventricular artery also supplies AV node. So the septal branch or the posterior interventricular artery supply two regions. Number one, posterior 1/3 of interventricular septum. Number two, AV node. So these are the points you have to know about the interventricular septum. So interventricular septum means, please note the embryology, very important. Muscular part is coming from the muscular proliferation. Membranous part will be the question. They can ask you in the coming NEET exam. So membranous part is coming from two sources, bulbar septum and the AV cushion. Bulbar septum nothing but a contribution from the conotruncal septum. Conotruncal septum, it is helping to divide the truncus arteriosus by forming the spiral septum, and they also contribute to the interventricular septum formation. That is bulbar septum. So bulbar septum is coming from conotruncal septum. Conotruncal septum. Conotruncal septum, yes, it gives two parts. One is spiral septum, number two bulbar septum. Spiral septum divide the truncus arteriosus, and the bulbar septum help in the formation of interventricular septum. Okay. Now the conotruncal septum is coming from, I hope you know, neural crust cells. Okay. So if you get any question from any one topic, please go through all the points about the concerned topic. Again, I am saying you get the question from the same topic, but you won't get the same question. Okay. So interventricular septum, these are the points you have to know for the coming NEET exam. So membranous part is coming from bulbar septum. Bulbar septum is a part of conotruncal septum. Conotruncal septum a derivative of neural crust cells. And AV cushion, you know. And blood supply, yes, these are the points. Okay. So interventricular septum, it is supplied by anterior interventricular artery and posterior interventricular artery, supplying posterior 1/3. Okay. Now what about these arteries? Diagonal artery. Diagonal artery 2019 AIMS exam question. Diagonal artery supplies only left ventricle. Diagonal artery is a branch of anterior interventricular artery which supplies the anterior part of left ventricle. Only left ventricle, anterior part. this artery is supplying. So diagonal artery is a branch of question, anterior interventricular artery. Diagonal artery supplies only anterior surface of left ventricle. Right. Now right marginal artery is a branch of, again, right coronary artery. Okay, anterior artery, you know. Left circumflex artery, a branch of left coronary artery. Okay. So now, what is the answer for this question? C is the answer for this question. Very easy question only. Right. So which of the following statement is true with respect to anatomy of the breast? Okay. Now supromedial or upper medial quadrant contains more glandular tissue. It is wrong. In the breast, upper and the outer quadrant contains more glandular tissue. Okay. Upper lateral or upper outer quadrant contains more glandular tissue. This is not correct. Now, ligament of Cooper found only in the upper quadrant. Again wrong. See, ligament of Cooper, it is coming from the dermis of the skin up to the pectoral fascia. It gives to give anchorage to the breast tissue. It is a modification of the connective tissue. It is present all over the breast, not only in the upper quadrant. It is made up of only 10 lobes. Again, this is wrong. It is made up of 15 to 20 lobes. In each lobe, we have 20 to 40 lobules. Tail of Spence extend across the anterior axillary fold. Yes, this is called axillary tail of Spence. It is extension from upper and the outer quadrant. So upper outer quadrant of the breast extend into axilla, that is called axillary tail of Spence, through one opening. That opening is called foramen of Langer. Is a correct statement. So in the choice, option C is right. Axillary tail of Spence extend across the anterior axillary fold through foramen of Langer. Okay. So C is the correct answer for this question. Right. Now, which vertebral level does the given cross-sectional image correspond to? So you see this section. Again, the recent INI-CET exam, we are getting one question from the cut section. So now this is a cut section. This is anterior and this is posterior. When I say posterior, because in the posterior, I am seeing the vertebra. Okay. Now in this section, we are seeing the organ, the massive organ on the right side. This is your liver. So in the liver, this is the left lobe of the liver. This is the left lobe of the liver, and this is the right lobe of the liver. Okay, left lobe and right lobe. Now, see diagram. Now the diagram, just in front of the vertebra, you are seeing esophagus. Esophagus already marked. This is esophagus. And below the esophagus, we are seeing the artery here. Yes or no? Yes, that is your aorta. So esophagus, and that is your aorta. Fine. And see here, below the liver, on the right side, you are seeing this tissue. What is it? Lung. This is the right lung. Similarly, on the left side, you are seeing left lung. Now, above the left lung, you are seeing the impression for stomach. So, stomach, how you are seeing, sir? The upper part of stomach, the fundus of stomach, you will see. Now, between the diaphragm and the stomach, you see one small organ here. That is your spleen. The spleen, okay. Right. Now, any other structure you are seeing here. Now, you are also seeing above this is the liver. Now, can you see diaphragm here? I will mark the diaphragm. This is the diaphragm. Yes or no? Yes. Now, above the diaphragm, can you see the heart? Yes, it is the heart. The heart is present between T4 to T8 only. Heart is present between T4 and T8. So, small extension, pericardium and the heart, you are seeing here. So, it is a section taken at the level of T9. Now, what are the other points to note here? Now, at the level of T9, erase all this. Now, you are seeing the veins here. See, veins with the collapsed lumen. I hope you know that. Now, can you see here? Yes. the large lumen on the right side, that is IVC. And here, these are the two other veins. These are nothing but hepatic veins. Okay. Now this is section taken on the left T9. So T9, please note down the heart. You see small portion of heart here, and you'll see the spleen just appear between the stomach and the diaphragm, and you also see the lung and see the hepatic veins and the IVC. What about T10? What are the changes you see in the T10? Now at the level of T10, you won't see any heart impression. So this is the liver. Above that, yes, you're seeing the diaphragm. You're not seeing any part of heart here. So heart, you won't see anything. Number 2. Now see the hepatic veins and IVC. The hepatic veins and IVC, they are very close. When you take section at the level of T10, this image of T10, the hepatic veins went inside the substance of the liver. They are not very close as in T9. So hepatic veins, they go into the substance of the liver. You see only IVC here. Again, a large right lobe and small left lobe. Now between the, just on the left side of IVC, you see a small part, that is a caudate lobe of the liver. Okay. And as usual, this is esophagus, and beneath that you're seeing aorta, and the small vein, again, that is the azygos vein. Sometimes they won't ask you. For the completion's sake, I am writing. Now, can you see one small white structure here? Yes, that is our thoracic duct. Okay. Again, stomach, you are seeing spleen, and you are also seeing, yes, the lungs, the lower lobe of right lung and left lung, you are seeing. Okay. So these are the differences you will see in the T10 and T9 level. The T10 and T9 level. Okay. So now point is, see the difference between, so this is the difference between T9 and T10 level. Okay. Now what about T11? T11 and T12, you will be seeing the coils of jejunum, pancreas and intestine you will see. Okay. That are not seen in the T9 or T10. So what is the answer for this question? See diagram. In the diagram, we are seeing very small part of spleen, very small portion of the stomach, IVC and the hepatic veins are very close, and you see the small part of the heart. So what is the answer? T9 is the answer for this question. Okay. Right. Next. Now, at what vertebral level does the marked part in the image lie at the normal anatomical position? See the diagram. In the diagram, marking was given at the level of ischial spine. And one more point, the bone is kept in the normal anatomical position. If you keep the hip bone in the normal anatomical position, the anterior superior iliac spine and the pubic symphysis should be in the same plane. Anterior superior iliac spine and pubic symphysis should be in the same plane, present in the same plane. First point. Second point, pubic symphysis and the tip of the coccyx should be in the same plane. Tip of the coccyx in the same plane. Number 3, see here, ischial spine. So if we connect the ischial spine of two sides, see here, they also present at the level of pubic symphysis. That means if you connect the ischial spine, they are passing at the level of the tip of coccyx. So ischial spine is present at the level of tip of coccyx. Ischial spine is present at the level of the tip of coccyx. And you know already, ischial spine is a landmark for giving pudendal nerve block. Pudendal nerve, it is lying over the ischial spine. Ischial spine, it is a projection between the greater sciatic notch and the lesser sciatic notch. Okay. So in between these two, yes, you see ischial spine. So ischial spine is a landmark for giving pudendal nerve block. So very easy question, but first time they gave this question. Very first time we got this question in the entrance exam. So ischial spine at the normal anatomical position, it is present at the level of tip of coccyx. So these are the questions you got in the anatomy the last 2024 May INI-CET exam. Still, we got some more questions in the applied aspect. The features of the oculomotor nerve injury, which are the following out of action of superior oblique, and they're asking about the hormone secreted by zona glomerulosa, I think. This is other questions you got. So around 15 questions you got from the anatomy, except 2 questions. All the questions were repeats only in direct manner. So the new pattern is, instead of asking the questions from one image, they started asking question from 2 image. So they given 2 image and then they asking the question. Again, they didn't give any question about any question in video based format, but in the future they will give you a question from the video based type. Again, in this INI-CET, they didn't give any question in the sequence arranged pattern. Usually they give 2 questions in the sequential arrangement pattern, but again, in this exam, May INI-CET, you didn't get any question from the sequential arrangement pattern. Okay, right. So these are the questions about the anatomy from the last INI-CET. Thank you so much and see you in the next session.